the next presentation entitled Exploring the Factors Influencing the Online Proxy Health Information-Seeking Behaviors of Parents of Pediatric Patients in Acropolis Green Subdivision, Barangay Bagumbayan, Quezon City, presented by Mr. Gabriel Chiapco Molen. Excuse me. We barely hear you. Can you please turn on the volume, please?
Excuse me, please turn on your volume. Turn on your volume.
Hello? Hello?
Okay.
Yeah, okay.
Yeah,
thank you.
I can hear you.
Okay, I will start. So, good morning to everybody. My name is Ryan, representing my group from Ateneo School of Medicine and Public Health from the Philippines. So, how many of you here have ever heard a patient say this to you in a consultation? Doctor, but I read on Google that my sickness is like this, or my medicine should be like that. So some worried parents do this for their sick children. Why do they do this? So our qualitative research showed how they search online is to help those parents make decisions for their children. So in 2019, Google logged 70,000 health-related searches each minute. And what used to be passively listening to doctors' advice and mass media became convenient and active seeking information through internet searches, such as asking Dr. Google. So, proxy seekers are those that search online for another person, and an example of which is the parent. So, parent online health information seeking behavior, or OHISB, has been shown to affect medical consultation, patient-doctor relationship, and health outcomes. So given this, the main objective of our study is to identify the rationale for engaging in proxy online health information seeking behavior of parents of pediatric patients, as well as how they compare information, where they look, and what they do after searching. So for our method, our study looked at the proxy OHISB of 13 parents from Acropolis Green Subdivision, Quezon City in Manila, Philippines. So this is an urban setting. So these parents were the primary caregivers to their children, and they live in the same household, and the parents have regular access to internet using devices. So a pre-interview questionnaire collected basic demographic information and internet searching habits of the participants. And this was followed by a semi-structured interview on Zoom to learn about their experience. The interview transcripts were then analyzed for codes and sub-themes, which we put together into a flowchart, which I will show to you later. So here, this is the main flowchart that we came up with, and as seen here, proxy OHISB is a process, and it's an interaction among 5 groups of factors spanning 4 phases, and which are influenced by 3 stakeholders. So let's start here in the search initiators. So, of course, before the parents search, they have a reason for searching. And then how they search, what they search, or when they search is affected by factors related to themselves as the seeker, and also related to the search subject, which is their kid. So when they do search, they engage in online health information seeking behavior. And then we are curious as to where do the parents search and how they compare the many information that they see online. And then finally, in the last phase, we see that we're interested in what the parents do after searching. So for some parents, when they search, they end up searching again, which forms some kind of cycle. But then for others, they proceed to their pediatrician to consult the health concerns of their kids. So I will just discuss the highlights of the themes and the insights we got from our interviews. So number one, parents search the internet to find out whether the symptoms of the child are serious or must be checked by a doctor. So the anxiety may motivate them searching online, but the searching can also cause anxiety. And then on the seeker side, parents search because the doctors are not always available and because of their medical background, or they search based on the age or the birth order of the child. So for example, if they're a first-time parent, they tend to search more because they do not know how to handle the health concerns of their kids. But when it's towards the younger children later on, they feel more confident as parents. So we also saw that parents with medical backgrounds engage in OHISB less and rely on more complex sources of information. And then the second point, how do parents appraise what they see online? The process is personal, and they compare and collect and arrange information that they get from the different websites. But eventually, a good number of them verify their search with their pediatrician. And they also get recommendations from their relatives who also use those medical sites. And then ultimately, parents recognize the expertise of a doctor, yet they exercise agency in searching online. So this leads to further understanding through the clinical consultation. So we move on to the implications. So I've talked about the three stakeholders in this process, which are the parents, the institutions that post online information, and the physician. So parents must share their searches with their doctors to get feedback and reassurance. The institutions must be diligent in providing quality information. And lastly, doctors must encourage patients to clarify their searches to create an environment where doctors and parents are safe. So the internet will play an even larger role in our patients' lives during our medical practice in the future. So it's better to make online searching an ally instead of an enemy. So now when a patient consults Dr. Google and tells us about it, what will you do? Again, my name is Ryan Molen, and thank you for listening to my presentation.
Topic is extremely profound.
Do you have any comments or any questions?
Congratulations. Because your subjects is the parents of the patients, right? I think the diagnosis of the disease of the children have some effect on how parents search for information. Do you have any information on your subjects that you interview that some of them may have the very severe diagnosis like cancer, or some of them maybe just figure it out about the influenza, something like that?
Thank you, sir, for that question. Actually, we saw that parents who are doctors or nurses or with a medical background, they search a little less frequent because they can rely on their medical background to give a good assessment of what the disease is. But then if they do search, they search on reputable websites because they know that's where to get the correct information.
Any more questions?
I have no question, but I think your paper is good for the current situation of the internet access of the parents. I think it's really, really interesting one. Thank you.
Thank you.
Thank you so much.